Erectile dysfunction is the inability to get and maintain an erection satisfactory during intercourse or to ejaculation. This is common as men age, and 1 in 4 men will experience erectile dysfunction at some point in their life. Erectile dysfunction can be caused by vascular complications such as issues with getting blood flow, or leaky blood flow out of the penis. It can also be caused by neurological issues or medications. In general, we tend to work up the patients by doing ultrasounds, physical exams, and lab work to see if we can get an idea of the cause of your erectile dysfunction. Erectile dysfunction is generally diagnosed using a penile ultrasound. We inject the penis with a pharmacological medication of Bimix or Trimix to cause a pharmacological erection. We then ultrasound the penis during its partially erect state to evaluate the blood flow in and out of the penis. This allows us to get a good picture of the erection, the straightness, and if there's any curvature, and allow us to customize a treatment plan based on your issues. Erectile dysfunction can be prevented by diet and exercise. In general, I recommend patients do cardiovascular exercise 3 times a week using 45 minutes of heavy cardiovascular work to improve the blood flow to the penis. I also recommend stopping smoking and watching excessive sugar intake. Patients may also benefit and have prevention of erectile dysfunction by stopping medicines that can cause erectile dysfunction, such as beta blockers and antidepressants. My focus and specialty is men's health. I can treat erectile dysfunction from pills, to linear shockwave treatments, to injections, to vacuums, and even surgery. Certain low-T clinics and shot clinics are only able to do certain of these items. Other urologists may not be fellowship trained and may not specialize in penile prosthesis. I make this my focus, and as a men's health urologic surgeon, it is my focus to treat and have a broad spectrum and treatment options available to you to customize your erectile dysfunction treatment. The treatment options for erectile dysfunction start with diet and exercise. Controlling your diet and doing regular exercise will help prevent erectile dysfunction and also improve erectile function as time goes on. In general, most patients we start off with PDE5 inhibitors, such as Viagra and Cialis. When these pills either do not work or you do not like them, I generally recommend we move on to either Muse, which is where we inject jelly in the urethra, or injection therapy. We recently started doing linear shockwave treatments for patients, and this is a clinical trial. If this doesn't work, we can proceed to mechanical treatments for erectile dysfunction, including a vacuum erection device with a penile cock ring, or placing an inflatable penile prosthesis. Based on your physical exam, your blood work to check testosterone, and also your penile ultrasound, we can come up with a customized plan of care to treat your erectile dysfunction. In general, patients that are using pills refill their pills like Viagra and Cialis 40% of the time, which means that 60% of the time they don't like this option. In my experience using Muse, usually 50 to 60% of the time patients do not like using this, as it's cumbersome to use and also can cause clitoral or penile burning. Injection therapy, or ICI, has a 50% satisfaction rate due to the cumbersomeness of putting a needle into your penis. Who wants to do that? And also the fact that the medication must be kept cold. The penile prosthesis satisfaction rate is 96%, by far the highest of all. Vacuum erection satisfaction rates is around 30%. Linear shockwave therapy is around 30% as well, although this is still in clinical trials. There are both physical and psychological consequences of not addressing erectile dysfunction. Not only can it cause penile shortening, but with lack of ejaculations, you may be at risk of increased prostate cancer. I recommend coming into discussing these treatment options and making sure that we can customize a plan of care for your erectile dysfunction to make sure we have the best you possible.